Have you ever looked at someone, or maybe even yourself, and just wondered, why is it so hard to just snap out of it? You know, what we tend to label as laziness or moodiness or a lack of willpower, it might not be a choice at all. It could actually be a silent, deep biological struggle happening inside the most complex machine we know, the human brain.
Okay, so let's really dive into that, because this question gets right to the heart of what we're talking about today. See, the answer isn't about just trying harder. It's about understanding the fundamental wiring and the chemistry that makes every single brain out there unique. We're going to start peeling back the layers on this.
All right, first up, focus and motivation. For so many people, this is a daily battle. And a lot of the time, it comes down to the brain's own internal reward system, which, just doesn't work the same for everybody.
I want you to imagine walking through life, but it feels like the volume is turned way, way down. That's kind of the baseline for a brain that's low on dopamine, which is that key chemical for feeling reward and motivation. So when everyday things don't give you enough of a kick, well, the brain starts searching for something, anything that will. You know, scientists actually have a name for this: reward deficiency syndrome. It's basically a way to explain why some people, especially those with ADHD, need much stronger reasons to feel motivated. And this has nothing to do with intelligence. It's about a brain that's constantly on the hunt for the dopamine it needs just to function properly. And this, right here, perfectly shows how that search for stimulation can play out. Sometimes it leads to really positive things, right? Like a high-intensity career as a firefighter or a passion for competitive sports. But it can also lead to much riskier behaviors, like substance use or reckless driving. The key thing to get here is that all of these behaviors are trying to do the exact same thing: get a surge of dopamine that finally makes the brain feel engaged and focused. Okay, now, let's shift gears and talk about mood. A depressive episode, it's not just having a bad day. Think of it more like a physical shutdown of the brain's pleasure messengers. It literally drains the color from life, leaving you in this constant gray void. This chart is a fantastic way to understand the whole landscape of our moods. So, way up at the top, you've got mania. That's a state of really high energy. Down at the bottom, depression. And right there in the middle, you see euthymia, which is really just a clinical term for a normal, stable mood. Most of us kind of bounce around in that middle zone, but for some people, the swings are just far more extreme. So, this brings up a really critical question. Let's say two people walk into a doctor's office. Both of them are currently in the middle of a major depressive episode. On the surface, they look identical. But are they really going through the same thing? Well, as we're about to see, the answer is a definite no.
This slide is so important. Take a close look. Both patients are at the exact same low point today, but check out their history. It tells two totally different stories. Patient 1 has only ever had lows. That's unipolar depression. But patient 2, in their past, they had an episode of hypomania, which is a kind of less severe high. That one little piece of their history changes everything. It means they actually have bipolar depression.
And this is why getting that history is absolutely vital. Mistaking one for the other is one of the biggest challenges in all of psychiatry. And it's an easy mistake to make, right? Because people usually go looking for help when they feel depressed, not when they're feeling amazing and full of energy during a hypomanic phase. And all of this has led to a major shift in how we think about depression. These charts show that what we once thought was this huge category of major depressive disorder is now being looked at again. A really big chunk of those cases are now being understood as being somewhere on the bipolar spectrum. And of course, getting the diagnosis right is the first, most crucial step toward getting the right treatment.
Now let's touch on another really common experience: worry. I mean, we all feel stress, but what happens when that worry just never leaves? What's the real line between everyday stress and a clinical anxiety disorder?
Think of it like this. Stress is your body's reaction to a specific thing, like a huge exam. Once that exam is over, the stress usually starts to fade. Anxiety, on the other hand, it's like a permanent alarm system that's just stuck in the on position. The worry is constant, it's excessive, and it's there even when the thing you were worried about is long gone. So, we've talked about the brain's reward system, the mood spectrum, and that anxiety alarm. Let's pull it all together and ask the big question: why does understanding all of this stuff actually matter? It matters because these conditions are never just one thing. Look at this slide. A depressive episode isn't just feeling sad. Not at all. It's a whole body experience. It can mess with your sleep,
your appetite, cause real physical fatigue, and even impact your executive function. That's your brain's ability to plan and get things done. It's a complex illness, plain and simple.
And that brings us to the most crucial point of all. These are not failures of will. They are conditions of the brain. And just understanding that one simple, powerful fact, that is the absolute foundation for giving real support to our friends, our family, and even to ourselves. It's what moves us from a place of judgment to a place of empathy and hopefully action. So I'll leave you with a final thought to take away from all this. If we truly, deeply grasp that these are biological struggles, not character flaws, how does that change the conversations we have? How does it change the way we build our schools and our workplaces and our communities to actually support everyone, no matter what their brain is going through? That's something we're thinking about.